lines or for lines when you laugh. But you must also know that Botox works on many lines. Starting right from the top of your face, you could erase your forehead lines, which are not really necessary, frown, which definitely our families will be happy without us having that expression, laugh lines, which sometimes really crinkles your face up and makes your eyes look really small. Under eye, some people have a little bulge. When you laugh, your eye becomes really chinky. So that part of it, you can relax that muscle to give you a nice, wide-eyed, happy smile. You could use Botox along the jawline, which is very popularly called Nefertiti lift. So it gives you a nice lift by completely easing off this muscle which pulls your face constantly down. You could also give a bit of a Botox to the corner of your mouth, which is a muscle called DAO, which pulls you down. Most of us look sad in some of our photographs. So you knock it and then you don't look so sad. They could also be done for things like a poppy chin. That looks pretty bad at times when you're talking and expressing. So when you give a bit of Botox there, combine it with a little filler, you could have a nice rounded chin. You could also give Botox for the smoker lip lines. You could Botox for the flary nostrils. You could Botox to lift gently the tip of your nose. They could also use the same drug to get rid of your bunny lines there. So Botox has various indications along with treating your hyperhidrosis, which is excessive sweating, and also your migraine headaches. For most of our injectable procedures or for microneedling, the anesthesia that we usually use is a surface anesthesia, which is just a cream that we apply. We will apply this Numby cream for some time, for almost an hour, remove it, and the patient is pretty much numb and takes any procedure that you do really well. This is a very simple injection.
Botulinum toxin type A blocks acetylcholine release by cleaving SNAP25, a cytoplasmic protein that is located on the cell membrane and that is required for the release of this transmitter. The affected terminals are inhibited from stimulating muscle contraction. The toxin does not affect the synthesis or storage of acetylcholine or the conduction of electrical signals along the nerve fiber. Evidence indicates that chemical denervation of the neuromuscular junction by botulinum toxin type A results in an expansion of the end plate region and growth stimulation of collateral axonal sprouts. A nerve sprout eventually establishes a new neuromuscular junction and muscle activity gradually returns. Recent research suggests that this new nerve sprout eventually retracts as the original junction returns to functionality. The sprouts disappear and the original end plate returns to full activity. In either case, repeat injections of Botox-purified neurotoxin complex may be required to maintain the desired clinical effect.
And last, but definitely one of the most popular things I'm asked for is open pores. One magic solution for open pores is to give tiny little diluted Botox along your cheek to make it look tight and glossy and beautiful like a movie star. Botox is one magic drug which was introduced to us. Thanks to Allergan, you can now erase all those wrinkles right away and have a fresh looking skin. Erase off those unwanted expression lines. This is how a patient would look after we have injected them immediately. There would be little blobs which is going to settle down in the next 10 to 20 minutes max. I've been often asked whether Botox and fillers are the same. No, they are not. Botox is a protein which acts by relaxing your muscle, so more given to the lines that come on action or expressions that come on action. Also, you give it to kind of counteract certain negatively pulling muscles or muscles which pull you downwards, so you can achieve a very fresh look, a facelifted look, a younger look, and a smoother look. Whereas filler is mostly made up of AHA. There are also other fillers like calcium hydroxyapatite, PMM, a whole load of materials, but the most popular one is hyaluronic acid, and that's very versatile also. You could use them for lines, you could use them as fillers, you could use them into the lip, volume enhancers, under the eye, so on and so forth. So that's very versatile to play with and to achieve really smooth results with not much of downtime. Filler is like a little magic brush in your hand. Give it to a painter, give it to an aesthetic physician. You could just pretty much paint into any face to make it look fresh, beautiful, glamorous. Either you take away the lines, which are more static, as in which are there whether you do any action or not, like your laugh lines, like your lines which we call as tear trough here, like those lines which come down from your mouth and make you really sad always, like those frown lines which are now etched really deep. So need a combination of Botox and filler, or that give you a beautiful enhancement and give you a nice high cheekbone, a mid-face which starts sinking as you grow older and the under eye looks sunken. You could end up filling that area. You could end up giving a little contour onto your jawline. The jowls, which most of us worry, 40 plus or 50 plus, used to be almost impossible to do anything about. Now, a round of thermage will make your skin thicker, collagen improved, and then we contour it by giving a little bit of a filler on the edges and then do a Nefertiti Botox to give it more strength. With a whole load of gadgets now and with combination of various tools that's available, like the Botox, the filler, the thermage, the Q-switched lasers, the peels and the microdermabrasions, and a wonderful regime with home care, you could pretty much get what you really dream of. There's nothing like a dream face now. It is achievable. You could also reverse your age back. You could also age gracefully. Whatever you may want, there is a solution today.
Doctor, what are open pores?
Pores are nothing but the end of a tunnel or the opening of your sebaceous or your oily glands. Sometimes when the glands get really clogged or overproduced, even the funnel along with it gets bigger. So when there's clogging in your oil gland, it just swells up so much that along with it, even the opening opens wide. One thing that you can do is make sure you deep cleanse your face, make sure you take adequate measures to lessen the oil production of your face. If it is clogged, then you try doing procedures to declog it and the pore size shrinks by and by and by. A home care that you can take is use a good cleanser, scrubber, and use also a very good toner. You could use products with retin A with salicylic acid in it, or go to your doctor's office to do certain peels which also helps in reducing your pores.
Doctor, I've seen a lot of youngsters having acne and adults as well. So, are these acne different or similar? What is it?
Usually acne is caused by a lot of hormonal imbalance. During younger age or older age, it could also be infectious acne. The other type of acne could be related to a little bit of an infection, a little bit of a pollution, and a little bit of clogging your pores, which all then lead to acne. That again could be the same to adults and youngsters. It could also be stress, which, as I told you earlier, that stress causes release of a hormone called corticosterone, and with that also releases a bit of testosterone. So these enhances your oil production and therefore may increase your acne. So it is hormonal, it could be lack of hygiene, it could be excess of oil production and infection all put together. So it could be on your face, it could be on your back, it could be on your shoulder. How do we take care of acne? Yes, we do a detailed medical analysis of your hormones, of the way your skin behaves, of the way your oil cells behave, and thereafter treat you accordingly. There's home care which is given to you, there's medical care which is given to you, and there are certain procedures which we can do in the office like peels and dermabrasions which help you reduce your oil and unclog your pores.
Doctor, what about acne and scars on the shoulder and back?
The causes remain similar for the acne on the back as well, but the treatment becomes a little more aggressive because the skin on your back is a little more thicker and resistant. I always tell my patients, please go to your doctors when the acne is on and active, because that's easier to treat rather than what it leaves behind. It can leave behind two major type of things. One is a color difference in your skin, and then the other is a texture difference in your skin. When it's color difference, it could be hyper or hypopigmented, in which case we end up giving you a whole lot of creams, or we could do office procedures like peels and lasers like Medlight will do a great result. When it is deep pitted scars and craters which are formed, then there are a whole load of techniques again where we do a punch excision and see how the scar goes back, or there's something called micro needling with a little derma roller, little needles on it which we literally roll on your skin. Mind perceives it as a lot of injury, but that's not actually what happens on the skin, but it starts producing collagen in an overdrive. So your scars bounce back, or we do something called subcision where we take a needle and cut across the scar tissue to bounce back your skin on top. We even leave a little bit of a filler material there which gives you an instant smoother look. These are the various ways of treating acne scars, but it never comes back to the plain, beautiful, smooth skin for a long while.
Is food and acne related?
Not at all. I know there are a lot of patients who end up coming and telling me that, Doc, I eat chocolates and my mother keeps yelling at me, your acne will increase. No, please mamas, just chill. None of those will really affect your acne. A lot of studies which show that there is only one ingredient which increases acne is iodine content in your food, which could be in your greens if they are not washed properly, could be in your crustaceans, could be in your prawn and stuff like that. So these are certain products that you need to avoid. Definitely not chocolates. Just go ahead and enjoy it.
Doctor, what are those white little bumps which comes under the eyes and near the cheeks?
I know, there could be two different things. It could be milia, it could be syringomelia. Syringomelia is a blockage of your sweat gland, but milia is blockage of your oil gland. The whitehead is nothing but at the end of the tunnel of your sebaceous gland or your oily gland. The secretions along with the plugged in dirt and your dead skin, they form into a little plug and plug it there, and then the outer layer of the skin is in continuation, so therefore it is just blocked secretions there. But in case of syringomelia, it's blocked sweat. So one is like a common whitehead which needs to be pricked, opened and released. The other, the sweat gland problem, cannot be pricked and opened and released. It just needs to be cauterized at that place. Peel and microdermabrasion are the two most common procedures done in any cosmetologist's office. These two pretty much do solve every problem, whether it is acne scars, just a dull skin, lack of glow, tan that needs to be taken out, your dead skin cells that needs to be removed. Peel does it all in a chemical way, and dermabrasion does it all in a mechanical way. I'm just going to clean your skin off with a spirit swab. We are going to perform a procedure called microdermabrasion, which is a mechanical aberration of a skin. We will just now show you how simple this procedure is. This is peel. We could do this with various type of peels, apply it and leave it for various times and apply it in various number of layers. All the combinations and permutations a doctor chooses once we examine your skin, and then depending on what kind of results you're looking, how fast, how much ready you are for a downtime is when we decide what type of the peel and how long we're going to keep it on your skin. And last, but definitely one of the most popular things I'm asked for is open pores. One magic solution for open pores is to give tiny little diluted Botox along your cheek to make it look tight and glossy and beautiful like a movie star. Botox is one magic drug which was introduced to us. Thanks to Allergan, you can now erase all those wrinkles right away and have a fresh looking skin. Erase off those unwanted expression lines. This is how a patient would look after we have injected them immediately. There would be little blobs which is going to settle down in the next 10 to 20 minutes max.
Doctor, how does one treat ingrowth?
Ingrowth is a very irritating problem. It's just that your hair which is growing from inside loses direction. So it does not grow out from its bulb straight into the aperture that is already there for it in the skin, but it just goes another way where there is no aperture. So it hits across your skin trying to open up, doesn't happen, then it coils there to form an ingrowing hair. So one most important thing is do not use really boiling hot wax. Do not wax if your hair is really thick. And then the best solution would be to go in and do your hair removal laser or hair reduction laser. Mesotherapy is a procedure wherein we give any drug or the chosen drug to the mesoderm of the skin. In this case, we are giving a combination or a cocktail of drugs into his scalp. The reason is for his hair regrowth. This is his fourth sitting and he's very satisfied with his hair growth. These are his previous pictures and this is the procedure now. Just about pricking or injuring the skin and letting the product inside as I am injecting. You would see very little micro bleeding which is gone after we just give him the first wash.